Let's get right into it. Welcome to This Explainer. Today, we're unpacking a massive, game-changing announcement in the world of medical education. If you, or maybe someone you know, is navigating that highly competitive, incredibly stressful journey to becoming a doctor, well, you're definitely going to want to pay close attention. We're looking at nearly 10,000 more MBBS seats up for grabs this year. And look, this isn't just some minor administrative tweak. This is a complete foundational shift in how we're educating the next generation of healthcare professionals. It's basically restructuring our entire medical pipeline.
To really grasp the sheer scale of this news, we gotta start right here. 10,000. I mean, just let that sink in for a second. That number represents a historic, unprecedented influx of new opportunities for aspiring doctors. We're talking about 10,000 more careers launching this academic cycle. 10,000 more individuals hitting the ground running in medicine. It is a massive, massive structural leap for our educational capacity, all happening in a single year.
So naturally, this brings us to the big question, right? Is the system finally catching up? You know the deal. The overwhelming, high-stakes competition students face every single year is just brutal. Cutoff scores are razor thin, and the pressure is honestly unimaginable. But with this massive addition, we really have to ask if our infrastructure is finally aligning with that skyrocketing demand. Are we actually turning a corner here? Let's dive in and find out. Section 1, the medical seat bottleneck. Okay, so we're all pretty familiar with the story of medical admissions over the last decade, right? It's been defined by sky-high demand just violently crashing into severely limited capacity. Hundreds of thousands of incredibly qualified, super passionate applicants fighting for a strictly, almost artificially restricted number of spots. It's heartbreaking because we've routinely seen top-tier students sidelined simply because the physical space, the lecture halls, the teaching hospitals, just wasn't there. This structural bottleneck hasn't just stalled brilliant individual careers, it's practically capped the growth of our entire healthcare workforce, right when we needed it the absolute most.
Section 2. 10,000 new opportunities.
Now, when we look at this expansion compared to previous years, we are not talking about some marginal single-digit bump just to keep pace with population growth. No way. We are adding an entirely new tier of access. For the students logging into their application portals this year, this massive jump in capacity is pure, unfiltered opportunity. It literally, mathematically shifts their odds of success. It's throwing open doors that honestly would have stayed firmly shut under the old constraints.
Section 3. Where are the seats?
You might be wondering, where exactly are all these seats coming from? They aren't just appearing out of thin air. They're being systematically spread across the educational map. First, we're seeing the inauguration of brand new medical colleges. Second, there are huge capacity expansions happening at existing, well-established institutions. And third, which is super important, we're getting a much broader geographic distribution of medical education. That last point is an absolute game changer. It means brilliant students from rural or historically underserved areas might not have to uproot their entire lives or travel across the country just to get a world-class medical education. Breaking that down a bit more, what we're looking at is a highly coordinated dual strategy. On one side of the coin, you've got fresh infrastructure. We're talking entirely new campuses opening their doors for the very first time, totally loaded with modern labs and facilities built straight from the ground up. Then, on the flip side, you have the expansion of established public and private sector colleges. They've aggressively scaled up resources, hired new faculty, and expanded their clinical training wings to handle more students safely. It's a really smart, two-pronged attack to hit that 10,000-seat milestone without taking a hit to the quality of the education itself. Section 4. The healthcare ripple effect. What's really fascinating here is how this transitions from a student's personal journey to our everyday lives. Easing this massive bottleneck doesn't just lower the intense admission anxiety and burnout for stressed-out applicants. That personal relief directly translates into a much stronger national asset. We're talking about a vastly improved doctor-patient ratio and a way more resilient healthcare system for literally all of us. When students have easier access to education, well, the public eventually gets broader access to medical professionals. It's a total win-win. Students achieve their dreams, and the nation secures a robust network of future doctors. Seriously, if you've ever sat waiting for hours in a packed hospital clinic just to see a doctor for 5 minutes, this right here is how we fix it. Today, 10,000 new students enroll. Looking at the midterm, those same students will be walking the wards, doing their rigorous clinical rotations, and actively helping with patient care under the wing of senior doctors. And zooming into the near future, that timeline finishes with 10,000 fully trained, highly qualified new doctors officially entering our national workforce. It's a direct, undeniable pipeline, from today's educational milestone to shorter wait times and better patient care tomorrow. So, circling right back to the core announcement,
Nearly 10,000 more MBBS seats are up for grabs this year. We absolutely need to view this as way more than just your typical seasonal admissions update. It's a historic, fundamental shift in our medical infrastructure. It's a massive commitment to scaling up human capital in one of the most critical sectors of our entire society, making sure that our talent pipeline actually matches the rapidly growing medical needs of the public. But before we wrap up this explainer, I want to leave you with one absolutely critical thought. Okay, so we've solved the capacity problem on paper, right? But as these 10,000 brand new students flood onto campuses across the country, we really have to ask, are our teaching hospitals, our senior faculty members, and our physical infrastructures actually equipped and ready to train them at the rigorous standard we all expect? Scaling up the sheer quantity of seats is a fantastic victory, for sure, but maintaining absolute, uncompromising quality, that is the real challenge for the years ahead. So I'll leave you to ponder exactly how this massive influx of talent is going to reshape the clinics and hospitals in your very own community.